COVID-19 has changed life as we know it. Worldwide, over 500,000 are dead, millions infected, and numbers continue to rise. Borders closed, schools shut down, cities are locked down. Global economy is at risk. In December 2019, a series of acute atypical respiratory disease occurred in Wuhan, China. This rapidly spread from Wuhan to other areas. It was soon discovered that a novel coronavirus was responsible. The novel coronavirus was named as the Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2, currently known as COVID-19. The outbreak of SARS-CoV-2 was considered to have originally started via a zoonotic transmission associated with the seafood market in Wuhan, China. But later it was recognized that human-to-human transmission played a major role in the subsequent outbreak and currently pandemic. The disease caused by this virus was called coronavirus disease 19 or COVID-19, and a pandemic was declared by the World Health Organization. COVID-19 has impacting a large number of people worldwide, being reported in approximately 200 countries and territories. And as of 5th July 2020, more than 10 million cases worldwide with more than 500,000 deaths reported. Patients infected with COVID-19 showed higher leukocyte numbers, abnormal respiratory finding, and increased level of plasma pro-inflammatory cytokines. So basically, coronavirus are enveloped, positive sense, single-stranded RNA virus that infect a wide variety of host species. And once viral bind to host receptors, they enter the host cell through endocytosis, or we call it as membrane fusion. Once viral content are released inside the host cell, viral RNA will enter the nucleus for replication. There, they will use viral mRNA to make viral protein, and then the new viral are made and subsequently released into our cells. So structural and functional analysis showed that the spike of SARS-CoV-2 bound to angiotensin-converting enzyme 2 or ACE2, of which its expressions was high in our lung, heart, kidney, and bladder. So in lung, ACE2 was highly expressed on lung epithelial cells, hence explain the respiratory symptom among those who are infected by this virus.
At first, we were told to watch out for coughing, fever, and trouble breathing. That is still true, but COVID-19 has a lot of possible symptoms, not all of which pointing to respiratory disease, even though the virus infects our airways and is thought to spread primarily through the droplets we breathe out. COVID-19 patients have experienced some unexpected symptoms that affect more than just their lungs, like GI problems, skin rashes, a loss of smell and taste. Some of this is due to our immune response to the virus, but scientists are currently focusing on the molecule the virus uses to infect our cells, the angiotensin-converting enzyme 2 receptor, or ACE2 for short. So this molecule lets SARS-CoV-2 affect us in a ton of different ways. ACE2 is a surface receptor with a bunch of important jobs throughout our bodies, not just our lungs, which also means that SARS-CoV-2 has the potential to infect a variety of cells. Scientists think the infection most often starts when the virus is introduced to someone's nasal passages. The nasal cavity has tons of ACE2 receptors, so it's a fertile ground for the virus which can invade those cells to replicate. At this point, the newly infected host might not have any symptoms, or they may develop fever, sore throat, dry cough, or loss of taste and smell. One study in mice from May 2020 found that ACE2 is expressed in cells of the nose that help transfer odors from the air to neurons, so the infection could block those signals. The researchers also found that older mice tend to have more ACE2 in nasal cells than younger ones. If this is true in humans, it could help explain why older people are more susceptible to the COVID-19. Upon infection, the virus can make its way to our lungs. The virus binds to ACE2 in the lungs, and scientists think that it disrupts the normal breakdown of angiotensin-2, leading to a vicious cycle of inflammation, cell death, and even blood clots that keep the lungs from getting oxygen to the body. So it is no wonder that many patients need help breathing. There are also symptoms involving the heart. In severe cases of COVID-19, doctors have observed cardiac injuries and complaints. COVID-19 patients with severe heart injuries also have been shown to have relatively high amount of ACE2 in their heart cells. For example, one patient in Italy presented at the emergency department with all the symptoms of a heart attack, but doctors could not find any evidence of blockage in the coronary arteries that would normally cause such symptoms. The patient tested positive for COVID-19. And while researchers don't yet fully understand the cause, it's possible that SARS-CoV-2 relationship with ACE2 is contributing the cardiac symptoms. And there's the gut. The lining of the lower digestive tract is rich in ACE2 receptors, which could explain why up to half of people with COVID-19 have diarrhea. A study in the journal Science Immunology showed that the virus can directly infect human and mouse intestinal cells in culture. Study also suggested that the virus breaks down before it exits the colon, making transmission via that route less likely, but research is still ongoing there. Researchers are still trying to get a clear picture of COVID-19 and all its symptoms. And this is just been the short list of things we're pretty sure can be traced to ACE2. We have barely touched on the more indirect effect that seem to be the result of our immune system going into overdrive. The good news though is that it also makes ACE2 a potential target for therapies, which opens up another potential treatment path for COVID-19. Global COVID-19 cases are approaching 13 million as of 12 July 2020 and has killed more than 500,000 people in just 7 months, with deaths remaining steady at the moment around 5,000 a day. According to the World Health Organization, the highest daily increase of cases globally observed on 12 July 2020, with a record of 230,000 cases. That's 2,000 more than the previous record set on 10th July 2020. By continents, North America is mainly responsible for the spike, followed by Southeast Asia, Europe, and Africa. By country, the US reported another record increase on the same day, with over 66,000 new COVID-19 infections, followed by Brazil, India, and South Africa. In Malaysia, the first wave of infections started on 24th January 2020, and a total of 22 cases were identified, of which 12 had a travel history to affected countries and regions. The second wave began on 27th February 2020 and are still ongoing. As of 11th July 2020, Malaysia had a total of 8,704 confirmed cases and 122 deaths. 8,515 cases have recovered and 3 cases are in intensive care. The states with the highest number of total reported cases are Kuala Lumpur with 2,445 cases, Selangor 2,079 cases, Negeri Sembilan 1,027 cases, and Johor 699 cases. Trends of new cases in Malaysia have been steadily declining due to strong public health measures and participation from society. However, in other countries, surges of cases have been seen on one hand due to newer, faster diagnostic methods, allowing more rapid and widespread testing, while on the other hand, the lack of social responsibility and complacency allowing for the second wave of infection to happen.
From the trend and statistic mentioned earlier, we can clearly see now that the COVID-19 that started initially as a local health crisis in China has quickly evolved into a global pandemic. The implications of the disease is being felt all around the world. Few reported COVID-19 complications in the study shows that severe COVID-19 can cause various organ failures and ultimately death. World Health Officials says that the mortality rate for COVID-19 is 3.4% globally, which is higher than the previous estimates of 2%. In comparison, the seasonal flu generally kills far fewer than 1% of those infected. The World Health Organization had said last week that the mortality rate of COVID-19 can differ, ranging from 0.7% to up to 4%, depending on the quality of the healthcare system where it's treated. The mortality rate of COVID-19 in Malaysia is 1.4%, which is among the lowest in the world.
COVID-19 have both direct and indirect implications to the world. Our healthcare system were not designed to deal with this kind of crisis. It is unpredictable and large-scale health challenge that requires urgent mobilization of resources and can affect the whole population. Hence, the most immediate and direct implication of the COVID-19 is to the healthcare system itself. In the absence of proven effective treatment and vaccine, our healthcare system will be overburdened with the number of patients being infected with COVID-19 and will be requiring care. The infrastructure and supply chains of the healthcare providers are being challenged. And importantly, our healthcare frontliners especially will be physically and mentally exhausted along with the worn out hospital infrastructure.
Apart from the direct implications of COVID-19 on the healthcare system, as the coronavirus pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear, worry, and concern in the population at large, and among certain group of people, particularly the vulnerable one, which is the older adults and the people with underlying health condition. But it is also important to note that the precautionary measures and strategies used to contain this pandemic include restriction of movement and quarantine, and this may have significant effects on the people's usual activities, routine and livelihood. It is expected that the level of loneliness, depression, substance abuse and self-harm or suicidal behavior will rise in this pandemic time.
According to the WHO survey released early June this year, prevention and treatment services for non-communicable diseases have been severely disrupted since the COVID-19 pandemic began. The impact is global, but the low-income countries would be the most affected by this. Many people who need treatment for diseases like cancer, cardiovascular disease and diabetes, they have not been receiving the health services and medicines they need since the pandemic began, as the health services have been either partially or completely disrupted in many countries. WHO reported that it will be some time before we know the full extent of the impact of disruption to healthcare during COVID-19 on people with NCD. But we do know that this group of people is at high risk of complication, including death, if infected with COVID-19.
The implications of COVID-19 does not only relate to health issues but also extended to the economic impact. For the first time in history, a health crisis has shut down the entire global economy, painfully demonstrating how inseparable healthcare and the economy have become. Estimates so far indicates that the virus could trim the global economic growth by 3 to 6% in 2020, with a partial recovery in 2021, assuming that there is no second wave of infections. The economic fallout from the pandemic raises the risk of global economic recessions, with level of unemployment not experienced since Great Depression of the 1930s. The human cost in terms of life loss will be permanently affect global economic growth, in addition to the rising level of poverty, careers derail and increased social unrest. The full impact will not be known until the effect of the pandemic peak. The economic implication of COVID-19 should not be taken lightly, as it is among the most important social determinants of health. Knowing all these implications is important, as it will help us to determine the measures and appropriate action to be taken to manage COVID-19 pandemic as a whole.
To date, there are no specific vaccines or medications for COVID-19, and we are relying on symptomatic treatment per se. However, among medications tested include antivirals, antimalarials, and corticosteroids. These treatments are under investigation and being tested through clinical trials. However, helping to contain the disease are several non-medical interventions, commonly known as public health measures, which are being used.
The word lockdown has never been more popular than during this pandemic. Countries globally have imposed lockdown as a preventive measure, requiring people to stay where they are in order to reduce the risk to themselves as well as others. Closer to home, the date 18th of March 2020 will remain in the memories of citizens as for the first time in history,
Perintah
Prime
Kawalan
Minister
Pergerakan.
announced the Movement Control Order.
Perintah kawalan ini dibuat di bawah Akta Pencegahan dan Pengawalan Penyakit Berjangkit 1988 dan Akta Polis 1967.
Under the MCO, restrictions include prohibition of mass movements and gatherings across the country, including religious, sports, social, and cultural activities.
Border restrictions were implemented on entry of all tourists and foreign visitors into the country. Sanctions covering all Malaysians travelling abroad, and for those who have just returned from overseas, health screening before immigration clearance, and a 14-day quarantine at various hotels.
Crews and passengers were also required to fill out a health declaration form prior to landing.
Closure of all schools, including kindergartens, boarding schools, study centres, and all other governmental and private institutions except those involved in essential services.
Health promotion and public education has been extremely necessary primary prevention measures in these times of uncertainty, as COVID-19 prevention efforts are largely involving individual lifestyle and behavior change. Important content given in appropriate languages includes social distancing of at least 1 meter, proper wearing and disposal of masks, hand washing with soap and water for at least 20 seconds, and when soap and water is unavailable, the use of hand sanitizers. The media's role in the pandemic could be seen clearly through education delivered via Facebook, Instagram, SMSs, as well as videos. More traditional methods, such as mobile van announcements by the District Health Office, have also been done. Reaching out to everyone with words that inform but not inflame, the daily press conference by the Director General of Health has helped the community get the facts they want and need to protect themselves and making choices and informed decisions. Surveillance provides rapid early warning information from clinics and laboratories, with sentinel clinics being set up to monitor those with influenza-like illness and possibility of having COVID-19. As secondary prevention, basic screening is done at triage counters of health facilities, including history of fever, respiratory symptoms, history of travel, as well as close contact with confirmed cases of COVID-19. Swab samples sent for PCR are taken in those high-risk groups with severe acute respiratory infection symptoms, with compulsory notification of all suspected and confirmed cases of COVID-19.
Each country will need to adapt their response to the local epidemiological situation and according to available resources. Evidence from the response in China and Singapore have indicated that efficient contact tracing helped reduce the time from symptom onset to isolation and may have substantially reduced the likelihood of ongoing transmission.
ICU and ventilators have been used as tertiary prevention to preserve lives of those diagnosed with COVID.
Stress and depression will require mental health and psychosocial support services. Other measures include mobilization and management of society's resources, such as the temporary makeshift of COVID hospitals both locally and globally. Creation of SOP for various places helps guide the community in preventing the spread of coronavirus while still being able to carry out their regular activities.
The MySejahtera is an application that is designed for COVID-19 contact tracing while providing related information of the disease, including preventive measures.
The COVID-19 pandemic that has taken the world by surprise, with its appalling scale, and has left behind devastating consequences no lesser than warfare. Although we are powerless in stopping an epidemic, we have the option to prepare ourselves better for future outbreaks. The first recommendation that is very importantly, we need strong, resilient, responsive and sustainable health systems to deal with the future pandemic. because we are also caught up in COVID-19, and we must also ensure that all other aspects of healthcare is maintained during the pandemic crisis. There are people with other serious diseases such as cancer, heart disease, or dengue, which are not neglected. Let this be a wake-up call to countries to strengthen their health systems to deal with any circumstances. The second recommendation, we need population which are socially responsible, aware, and committed to supporting the government in preserving and strengthening nation building and national identity. Third, probably one of the key messages, we need strong political leadership at the highest level to ensure good governance at all levels. There are 5 sub-dimensions. First, we need to have unity of purpose with no political interference or agendas. Second, to work together in unison, coordination, and synergy. Therefore, avoiding contradictory and confusing policies at different levels. The third dimension is to be flexible and adaptable. Fourth, the decision made has to be evidence-driven at all times. And finally, have to provide adequate resources. Next, we need to be prepared for the new normal where we need to learn to live with the virus. The health systems and the government policies need to have the capacity to tackle the outbreak situation. Virus will not disappear anytime soon, but more likely it will become endemic with mostly mild cases like seasonal flu as populations develop herd immunity. Last recommendation, we need more than ever regional and international agreement to avoid unnecessary polemic, blaming others, and conspiracy theories, because the focus should be on the need for collective action based on trust between countries and basically the goal of saving humanity. In conclusion, our strength lies in our unity by setting aside our differences and coming together as one to fight the pandemic and win the battle against the deadly virus.